So,
But the general idea is night eye, it's shape memory, it's heat activated.
okay, so is this a differential
Yeah, you know what?
materials in the arch is different properties?
It could change even in one Brava, maybe, if you look at, if you hold a Brava, if you bend those arms, you can clearly feel one of them might have higher force, one of them might have lower force. So, the property is different, thickness is different, design is different.
Because the design, I saw that you have many curves in the difference of each tooth, so you can change the flexibility of each tooth. But I just wonder for the properties of the materials, so it is some differential in the same arch.
Yes.
Okay.
So, for example, you want to have higher force in the buccolingual direction, but you want lower force in mesiodistal, but you want like a certain moment in, for example, angulation. So all these are going to be the input for the software, and that the software designs something that will have, let's say, higher force in buccolingual, but lower force in mesiodistal, and so there's going to be infinite designs that you can have. And that's why at the very beginning of my talk, I said that even if you have 10 million patients, none of these two patients will have exactly the same arm. They might be similar, but they're not going to be exactly similar. For example, the thickness of one of them is going to be, let's say, 0.4 millimeters. The other one is going to be 0.401 millimeters. They're going to be close, but they're not going to be exactly the same statistically.
Wow, very smart.
Yeah, thank you.
My second question is about the vertical, because I can see that for the buccolingual or mesiodistal, it can do it. How about the vertical dimension? How you intrude and extrude with this kind of system?
Yeah, sure. So that's a good question. For example, extrusion is very hard with aligners, right? But with fixed appliances, Brava is a fixed appliance, you can easily do the extrusion or intrusion. The difference between independent movers with braces is that you have the same thickness of wire everywhere, right? So you cannot really control how much force you want to apply, for example, to the premolar as opposed to the incisor when you are intruding the incisor, right? But with Brava, you can control that. You can have the optimal force for the premolars while you are decreasing the force, for example, for incisors. For intrusion, you want to apply a very light force. And to apply the light force, you can control that with Brava for the incisors, but having like higher force for the molar to get anchors from the molars or premolars. So we can control all of these things, and it's very efficient. As I showed, deep bites get corrected super fast. Or if you want to, for example, do an open bite case, obviously in some cases you need auxiliary movements. For example, in Dr. Ken's case, you need some auxiliary movements, but in general, vertical corrections is very doable with independent movers, and you can do them from the very beginning of the treatment. Not like, for example, some open bite cases we have to wait again to have higher, heavier arch wires, and then we can give elastics to the patient. But with Brava, you can do it from the very beginning when the patient is more compliant. Yeah, sure.
Why did you share about the extrusion? That my granddaughter case, because she needs a lot of extrusion on the posterior left flank. But when I try to engage the arm in and close, I push with the bracket opener and I close it back. The one thing is, in the successive visits, sometimes I see some arms like a spring up because they're trying to just bounce back, right? So, do you have any tricks for us to prevent the arm to just spring out from the brackets because they try to extrude, right? But sometimes the lock is not strong enough to hold.
So it's a good question. This is important. Sometimes when you see the patient, when I see the patient, basically, in many cases, I don't do anything. I just take photos and scan the patient says, that was it, I said, that was it. because I want to do the presentations. But something that I always do, I make sure that all those clips are closed. Because if the clips are not fully closed, maybe an arm comes out, or maybe the arm is like in, but it's halfway in. So we should make sure that the arms are all the way in. Because, for example, if the arm is halfway in, or it's a little bit rotated, it will affect the accuracy of tooth movement. So it's important that every visit we just make sure that all the clips are closed. The first visit maybe, you're not like very used to it. All the clips are not fully closed. But the second visit, we are more relaxed. We're confident that we have put everything, so we make sure that all the clips are closed.
Thank you for
To add this, the clip you need to close. Yeah, you need to squeeze the clip. Yeah, right. Yeah.
Thank you for an amazing and eye-opening lectures this morning. So I have less of a clinical question, but more of a management question regarding patient payment. How do you charge a patient